Hello everybody, welcome to Just Upright. My name is Doc Jean Ruder. I'm a doctor of physical therapy and I'm a certified dementia practitioner. If you are new to my channel, welcome. And I would like to thank again my subscribers, my viewers. Thank you for supporting the channel and thank you for sharing this channel and the videos in this channel to your sphere of influence. I really appreciate all your support. So if you are new, you can check this out next video on how to navigate and find the answers to your questions in this channel. Explore the Just Upright channel by clicking on the playlist, and then it will take you to this page, and you can see as of the recording of this video, I have 47 videos currently on how to become a physical therapist here in the US. I also have health and wellness videos, videos on how to become an on-call therapist, physical therapy documentation, and other useful resources, and some videos that are inspirational, fun, and practical. So check those ones out. Check out my published books at Amazon.com. If you type GINALYNRUDER, my books will pop out. If you are a foreign trained therapist, physical therapist, and want to be guided on the step-by-step process on how to become a licensed physical therapist here in the US, this book is for you and it has good reviews on Amazon.com. The next book is Practical Tips for Therapists Prior to Migrating or Starting Your US Practice. This book is full of wisdom for you to be psychologically and professionally prepared before embarking into your US practice as a therapist. The third book is Just Upright, Practical Tips to Improve Posture, Balance, and Decrease Fall Risk. These are for older adults with practical exercises you can do at home modification program, and priceless information that may improve your life and enjoy your retirement years. And these are also for clinicians. I have Clinician Corner here that has standardized tests backed up by research studies and other evidence-based practice that you can use and utilize in your clinical practice. I have planners, beautifully designed planners, monthly and daily planners, 2-year, 1-year planners, journals, coloring books, kids' notebooks, handwriting, sports, and various types of notebooks. So check those ones out. Okay, so today I'm going to talk about very important information about Medicare, okay, and how it impacts your therapy, for older adults, okay? So first, we have what we call a traditional, original, standard Medicare that is still under the control of the federal government. And then we have what we call now the Medicare Advantage plans, which are under the control of the private health insurance companies like Humana, Essence, UHC, and the like, okay? So when you say standard Medicare, it has Part A, Part B. Part A covers your hospitalization and your therapy. Part B covers your doctor and outpatient, consultation and imaging or labs. Okay, so this is a simple comparison of original Medicare versus Medicare Advantage. Okay, so original Medicare includes hospital coverage, Part A, medical coverage, Part B. Okay, Medicare Advantage combines hospital coverage, Part A, medical coverage, Part B, and additional health benefits under one plan. Okay, original Medicare does not provide prescription drug coverage. Medicare Advantage often includes prescription drug coverage. Okay, original Medicare does not provide additional health benefits. Medicare Advantage can include additional health benefits such as dental, vision, hearing, and fitness. Original Medicare provided by federal government, and Medicare Advantage provided by private insurance companies with varying benefits, costs, and coverage options based on location and provider. So at first glance, older adult will go for, sign up for Medicare Advantage because it covers your prescription medication and it covers dental, vision, and hearing and fitness depending on the plan that you sign up for. And so it's very enticing. And comparing the premium that you have to pay between the original Medicare versus the Medicare Advantage, it is more expensive to keep the Medicare or traditional standard Medicare compared to Medicare Advantage. But what that table did not include is the comparison of therapy sessions that you can have between Medicare, standard Medicare, original Medicare, and Medicare Advantage. Okay, so this is where I'm coming from, is from the therapy standpoint. Okay, so if you are healthy, if you don't have a lot of medical conditions, okay, you don't have a lot of debilitating conditions, the Medicare Advantage plan may be good for you, okay? Because, you can go to the gym. The silver sneaker usually is part of their program where you can go to a silver sneaker participating facility and you can use their equipment and be healthy, okay? Keep on exercising. They sometimes cover your dental, your vision, your hearing tests and procedures, okay? So if you're healthy and you're younger, that's good for you, okay? And you're not sick, that's good for you. But as we grow older and more sickly, and you have a lot of conditions such as hypertension, hypercholesterolemia, you have stroke, you had stroke, or you have other debilitating conditions that most likely you will go to the hospital and you will be needing a lot of therapy to recover, Medicare Advantage is not a good choice for you. Why? Because they limit the number of therapy sessions that you can get, irregardless of what the therapist documented or suggested or recommended for the patient. What you can do about that is to fight them, to appeal. And the question is, will you win the appeal? Okay, this is a very sad situation because you don't have to fight to get what is right for you or what is appropriate or recommended for you to regain your function, to be independent again. Okay, so in a real setting, in a real life setting right now, in nursing homes or home health therapy, when a patient comes with a traditional Medicare or standard or original Medicare, for as long as the doctor prescribed therapy, for as long as the therapist documented that the patient indeed need therapy in order for the patient to recover and be able to be independent as he or she can, to be able to go safely back home. The regional Medicare is very lenient for as long as it is medically necessary for the patient to receive the therapy that the patient needs. Medicare Advantage will give you X number of sessions. 1 week, 2 weeks, in rehabilitation facility, then you're done. You have to go home, okay? Unless, again, you appeal. And it's a question whether you're gonna win the appeal or not, okay? So, yes, Medicare Advantage is cheaper, but you will get what you pay for, okay? With regards to the therapy. So I am speaking out right now because this is a growing problem, especially in skilled nursing facility. Patients are being, asked to go back home even before they are fully safe and independent, because the health insurance company will not authorize more sessions for extensive therapy in a skilled nursing facility. Okay, so I even spoke to a rehab director today, and she is a physical therapist. Her mom is a physical therapist. Her grandparents have this Medicare Advantage, and she told me that her grandma had a stroke, and so she knows, and her mom knows, the pathway, the safe pathway for her mom to go back home. So she was hospitalized. They had to fight so that the patient can stay in the hospital to have an inpatient rehabilitation, meaning more extensive therapy before the patient can be discharged. So after they fought for the grandma to have an inpatient rehabilitation, the company, the insurance company said, well, she can go home now and have home health therapy. But they had to fight, and she said, no, we want her to have more therapy in a skilled nursing facility, short-term stay, so that she can have more therapy before she can go home. But the rehab director is a physical therapist. Her mom is a physical therapist. They know what they're talking about. They are knowledgeable on what an older adult should have in order for the grandma to be able to go back home safely. If the family member and none of the relatives of the patient know anything about therapy, then they are just stuck with whatever these insurance companies will advise them or will give them. Okay, they don't know how to fight, they don't know their rights, they don't know the correct pathway to recovery. So it is you're being taken advantage. Okay, Medicare Advantage, maybe that's why it's the name, I don't know. But I just want to recap. Okay, Medicare Advantage sounds good because it's more economical. You're paying less than having a traditional Medicare Advantage per month. It has a lot of perks. You have dental, vision, hearing, fitness. They cover the medication. So these are good if you're healthy and if you are not debilitated, you're not very sick, and you don't need hospitalization and extensive therapy. That is good. But if you're getting weaker, you're getting sicker, you have a lot of medical issues and conditions, chances are you're needing to go to the hospital now or in the near future, and you're needing a lot of extensive therapy in order for you to recover, bounce back, be as independent as you can be so that you can go back home. Traditional Medicare, original Medicare will be the best for you in order for you to get the therapy that you need, okay, in order for you to recover from whatever conditions sent you to the hospital. Okay, so I hope that this video is helpful. I wish that you would share this video to your older adults, family members, to anyone who is thinking about switching to Medicare Advantage. Okay, so the question is, what will I do? I already signed up for Medicare Advantage. Okay, so I was told that you can switch back to a traditional Medicare. So if you can switch back to a traditional Medicare, I would suggest you switch back, because the amount of money that you're saving from that Medicare Advantage, because it's cheaper, you will pay again, you will get what you paid for. It's cheaper to have Medicare Advantage, so you will just have X number of therapy because that's what you paid for. So if you think you will be needing more therapy because of your conditions, you will have have a long road to recovery because you're older, you might fall, break a bone, chances are you're needing to go to the hospital and have extensive therapy, you switch back to traditional Medicare, okay? If you have Medicare right now, traditional, okay, traditional or original Medicare, do not switch to a Medicare Advantage, okay? Again, you'll just never know when you're gonna get sick. You'll never know when you're gonna have a hospitalization. You'll never know whether you're gonna be needing extensive therapy. And it is more lenient. Medicare, a traditional Medicare is more lenient to give you the therapy that you need, that is suggested or recommended by your doctor and your therapist, okay? So I hope that you will share this video, the other videos of Just Upright, that will be beneficial for you and for your loved ones, friends, relatives, and sphere of influence, so that we can help as many people as we can for as much as we can. Thank you so much for watching and stay blessed. Thank you so much for watching. Please do not forget to hit the subscribe button below to be updated with the latest video releases. Share this channel to other people you know who will benefit from Just Upright videos. Thank you again and stay blessed.